again, just to note that the 4 golden rules of stretching and strengthening. For strength exercises, if you know the action of the muscle, you can do this. If you then know the opposite of the action, which should be pretty straightforward, then that's how you're going to stretch the muscle. Remember, using a free weight is movement against gravity, and resistance tubing should be parallel to the movement. Ready to go? Okay, so first muscle we're going to look at is upper trapezius, and we're going to do a stretch for it. So to do a stretch, we want to do the opposite of its action. So what's the action of upper trapezius? Elevation. Elevation, good. So we're going to have to depress it. So I'm going to demonstrate this first, and then I'm going to have you do this, Karen. I'm going to put this TheraBand over here. So the stretch is, you're going to sit down in a chair, put your hand on this chair just to anchor this arm, lean the head to the side, and in effect this will depress the scapulae. 30-second hold. And I'll have you do that for me, please. Okay, looks good. Upper trapezius. Note that this is the same as levator scapulae. This is a synergist, so same stretch. Let's move down to rhomboids. You can have a stand up for me, please. To stretch rhomboids, first of all, what's its action?
Retraction.
Good, it retracts, so to stretch it, what's the opposite?
Protraction.
Protraction, perfect. Nice easy one to do this one, Karen, is just to interlace your fingers and press your hands forward like that till you feel a stretch in rhomboids. That's between your shoulder blades. Can you feel that there? Good. And we'd hold this again for 30 seconds. If you wanted to do it one side at a time, just pull the arm across like this, and then of course the other arm goes the other way. Rhomboids. Notice its synergist is middle trapezius, so this is done the same way. Now we're going to drop to pectoralis major. Pectoralis major has a fairly complicated action, right? It does adduction, we know it pulls in. It does internal rotation as well. So at the very least, we've got to do that as its opposite to stretch it out. One of the best stretches for that is to simply put your hand up against a door, like a door jamb, and then you can turn your feet to the outside to feel a stretch in pectoralis major. You want to try that one there for me? As always, the stretches are held for 30 seconds. Perfect. Turns the feet away. Pectoralis major. Incidentally, this is similar to how you would stretch teres major. Thank you. Latissimus dorsi. This muscle here is also complicated in its actions. So it has multiple actions. It does adduction, internal rotation, and extension. But it attaches to the sacrum and the pelvis. So to stretch it, it's not so simple. We've got to get a lot of parts into it. One of the nicest ones to do is to take your arm above your head like this for me, and then just grab the opposite elbow and then just lean the body over. Perfect. You feel the stretch down the side, right? So that's for latissimus dorsi. Excellent. You can see now, moving down the list, we only got 2 left, really, and that's wrist flexors and extensors. To stretch your wrist extensors, do the opposite, and that's going to be flex the wrist. Notice that I have the elbow extended. You'll intensify the stretch because some of these muscles do attach onto the humerus lateral epicondyle. And then to stretch the flexors, it would be the opposite. Perfect. Wrist flexors and extensors. Let's now move to strengthening, and we're going to do start with TheraBand or Therapeutic in this case. And I'm going to hand you a piece like that. We'll just do this together. Pull this chair out of the way. We'll start with upper trapezius. So to strengthen, back to its action. What's its action again?
Elevation.
Elevation, perfect. Let's go ahead and stand on that TheraBand. Have your arms by your side, and just have enough tension on the TheraBand so when it's at rest, it has some degree of tension on it, and then it's just simply elevating the shoulders. You certainly could do this one arm at a time as well, of course. What is the synergist to this muscle which is doing the same action?
Levator scapula.
Good, levator scapula. You see I've conveniently put them up there together. Okay, good. Next muscle, it says, is serratus anterior. Its action is protraction. So we're going to take the TheraBand this time, put it around your back, and have your arms, your glenohumeral joints, so you're flexed 90 degrees. This is your starting position. From here, protract. So it's a very small movement, isn't it? Yeah, exactly. So protraction, and the synergist, as you can see, is pectoralis minor. Same action. Okay, let's move down to rhomboids. For rhomboids, actually, I'm going to get you to hang on to that TheraBand. I'm going to hold on to the other end, actually. You hang on to the ends of it, and I'll hang on to the middle. This is the game of trust. I'll hold this up a little higher, so you're up at 90 degrees. Good. This time, just retract your scapula. That's the starting position. Very good. And this is retraction. Obviously at home, I get the patient to tie this up to something at this level, or they could tie it into a door and close it, just making sure nobody comes. Okay, perfect.
There's a dot on.
Whoops. Okay, so we've now done, where are we at here? We did middle trapezius as well. Now we're going to do pectoralis major. Pectoralis major, as I mentioned with the stretch, is a fairly complicated muscle. So there are lots of ways you theoretically could do this, but one relatively simple way, take the TheraBand behind your back, and I might get you to take that for me there, Karen. And once it's behind your back again, we'll just keep the arms about 90 degrees, and it's just adducting the arms together. Now the arms are internally rotated a little bit already, so just this movement here effectively will work pectoralis major. Also teres major at the same time. Okay, good. So we've done pec major and teres major. Latissimus dorsi, one of the best ways to strengthen this one is to have the TheraBand tied up at a little bit of a higher spot. So Karen, why don't you get you to come around this way here. We'll use this TheraBand. I'm just going to hang on to that, once again, a little game of trust, and reach your hands up a little higher for me. Yeah, right about there, good. And this time you're going to pull the arms down and into your body, very good. Okay, so this is latissimus dorsi. It does extension, adduction, and internal rotation. Very good. And at home I would just get the patient, to find something like the top of their door. So this is latissimus dorsi. Its action is adduction, extension, and internal rotation. So we've got the TheraBand up quite high, so we can get Karen's arms up quite high, so she can get more extension. And go ahead and pull that TheraBand down and in. Good, so she's adducting, extending, and internally rotating. Perfect. And let go of that, thank you. All right, next exercise we're going to look at is, let's see, we're still working TheraBand. We're going to coracobrachialis. So I'm going to hand you that one there. Let me find my other piece that's over there. Oh, great, thank you. And let's go ahead and you're going to stand on this TheraBand or TheraTubing, and just stand on it. So again, you just have a little bit of tension. We'll just do one arm at a time with this one. Perfect. So for anterior deltoid or coracobrachialis, just come up to 90 degrees. Don't worry about the position, whether you're pronated or supinated, because this is for the glenohumeral joint and it doesn't make any difference. So that's going to be for coracobrachialis, also for anterior deltoid. Staying right here, let's do a couple of other muscles. Let's do, I'm going to just get a little more tension on this one, and we're going to do supraspinatus. So supraspinatus up to 30 degrees, and then staying here would be middle deltoid would come out to 90 degrees. So very synergistic, those two muscles. We're going to stay right here, and I'm going to jump down. It's to posterior deltoid, and I'm just going to do these together because they're right all in the same position. And that's just bringing the arm backwards into extension, posterior deltoid. Good. Well, let's stay with our foot right on that because there's a couple more we can actually do right here with TheraBand and our TheraTubing. And let's do biceps brachii. So if you would supinate for me, and that's biceps brachii. If we turn to go thumb up, we'll do brachioradialis. Perfect. And then go palm down, you can do brachialis. Excellent. Okay, that's good. For all that position, I think we did 7 muscles there, so that's kind of handy. We can actually also do triceps, even if we keep standing on that. Well, why don't we do that? This time you're going to need a little more tension because you're going to bring that arm behind your back. So once you get all the way behind your back, starting position is here, and then it's just elbow extension. So triceps brachii, yeah? Good. Okay, supraspinatus, we did that one. That was abducting to 30 degrees. Middle deltoid, we did that one. That was abducting to 90 degrees. Posterior deltoid, we did that. Infraspinatus, let's do that one. So what's its action? External or lateral rotation, good. So with this one here, Karen, you can start with your other arm sort of supporting it. Remember, the rule is it's got to be movement parallel to the TheraBand or TheraTubing, and it goes like that. Perfect. So that'll work infraspinatus, and it also works teres minor. I put those two together for that reason. Now, finally, we're just down to the wrist. So wrist flexors, what you can do is, once again, stand on that TheraBand, and your elbow could be straight or bent. Let's just have the elbow straight and wrist flexion. And now we can turn over and do wrist extension. Good. For pronators or supinators, it works pretty well with TheraBand. First of all, in terms of supination, we just get our hands like that and just get a little bit of tension on. The hands are pretty close together with this one. And then you'll see I'm going to just turn over into supination. and that will add some resistance as I go into supination. For pronation, it's a bit funny. You kind of have to cross the arm over because you're going to be pulling in against resistance. Yeah, exactly that way. Good. Then you exactly pronate against resistance. Okay, so pronators and supinators. There's really not, it doesn't work that well because gravity obviously is not going to be doing a lot for you this way or that way with a free weight. Good. Let's go into free weights now. Now this should look like quite a bit of a review. I'll pass you one weight and I'll do the other. So upper trapezius, elevation, follow the action. The synergistic muscle is levator scapulae, paired with it. Okay, serratus anterior, which position are we going to have to be in? This is protraction.
Horizontal.
Good. Get the person lying down. Can I get you, if you wouldn't mind, please, Karen, just put your head at this end. Great. And starting position is all the way up into this right here. And then now she just protracts. Okay? So we're focused just on serratus anterior and pec minor in that case. Excellent. Thank you. Why don't I keep you there, and we'll just do all the ones that are in this position. So let's see. I'm going to move down to the rotator cuff. So let's do infraspinatus and teres minor. If you wouldn't mind facing that direction. So for infraspinatus and teres minor, they're lateral rotators. So position of the arm is 90 degrees. Starting position is here, and then as far up as the arm will rotate. Infraspinatus and teres minor. Let's do arm straightens out up to 30 degrees, and we've got supraspinatus working here. Okay? And as she goes any past 30, the gravity isn't going to be in play. So we'll get to deltoid in a bit. I think that's it for laying down, so I'm going to get you to stand back up for me. You can keep holding on to that weight. Let's go back to our list. We did pec minor, serratus anterior. That was lying supine. How about rhomboids? Which position are we going to have to be in for that one? Perfect. So in this position here, bent over against gravity, and it's just scapular retraction. Very small movement with the scapula. This will also do middle fibers of trapezius. Pectoralis major and latissimus dorsi. Let's do latissimus dorsi. Once again, have to be bent over against gravity. You can be holding on to something or not. And the arm then just comes back like you're kind of starting a lawnmower, really. But nice, you want to get full extension and adduction with internal rotation. Latissimus dorsi. Let's see, what else do we have there? Teres major, we're going to say that's similar to pec major, so let's do that on this plinth. We should have done that one earlier. I'll pass you the other free weight. In this position here, we're actually going to get you to just make sort of these big movements here as the arms and elbows bend, and then bring them together. So this motion here is going to work pec major as well as some teres major as well. Okay, perfect. I'll take one of those weights away from you, and I'll get you to stand up again. And now we're moving into the muscles that we did in TheraBand, coracobrachialis, which is just forward to 90 degrees, same as anterior deltoid. Next one is out to the side, middle deltoid, same as supraspinatus, at least to 30. And then I'm going to biceps brachii, moving into supination. Then brachioradialis, staying as a hammer curl. And then finally, fully pronated and flexing will work brachialis. Triceps brachii, a couple of options for that. One can be bent over against gravity, elbow tight to your side. Or the other one could be the hand goes behind you and simply just extending the elbow. Sometimes the elbow needs support, particularly if it's a heavier weight. Supraspinatus, we did that in side lying. Middle deltoid, we did this one out to the side. Posterior deltoid, have to be bent over a little bit against gravity again, and this is just bringing the arm straight back against gravity. Infraspinatus teres minor, that was done in side lying. Wrist flexors and extensors, that's all that's left. And this one here, if possible, we'll try to find some support, just like a little table or something. Wrist flexion, and then obviously wrist extension. Good. So all stretches are held for 30 seconds, roughly. And as far as sets and reps go for the examination, you don't have to talk about that. Generally, with most strengthening, it's somewhere between 10 repetitions to 15 repetitions, 3 to 5 sets. But that won't be part of the exam. Okay, good.